I'm seeing in a number of different clinics at UCLA right now because I have a number of chronic conditions. And so the ones that I use the most are the ones that are related primarily to healthcare information because my background's in hospital administration. I'm a nurse with a PhD. So, I'm going to be using, some of the medical dictionaries. I use a number of the apps that are very specific for the type of disease that I have, and I'm not going to go into specifically what those are. And I have to say that the UCLA MyChart patient portal is something that I almost have to use on a daily basis because of the complexity of my care and the fact that there are I actually counted yesterday, I have 18 different physicians that are listed on my UCLA MyChart, and so I have the ability to be able to, manage my prescriptions through that, being able to message them, look at lab results, and particularly as somebody who has some healthcare background, that allows me to pretty much manage my care and know exactly when to be calling the office or messaging my, medical professionals. It has its shortcomings, but it also has all the key pieces that I think that are there to allow me to sort of orchestrate my own healthcare from my home, or wherever I am. And I use it on my phone primarily. So I've been using my phone as my primary method of communication like everybody else for a long period of time. And once the MyChart app became available on my phone, it made it a lot easier. Well, I see a lot of different physicians here at UCLA, and I would say that's a mixed bag. There are still some that are asking me to call them on their cell phone, some who are asking me to use their email, and others who primarily use the MyChart app. And then there's others who you'll message and you'll never get an answer back. Or you realize that the answer you're getting is not from the physician, but one of their medical professionals, or sometimes even an MA. And if I were unfamiliar with the roles that those different professionals played in my care, I might not be able to differentiate how I would interpret that information.